Hello, my name is Mayowa Adeshina. I'm a DMP student from Brandman University. Today I have the pleasure of having with me here Tolu. Good morning, Tolu. How are you doing today?
I'm very well, thank you.
Alright, so today, Tolu, I'll be doing a nurse practitioner full head to toe physical assessment on you. Is that okay?
Yes.
Alright, so prior to coming into the room, Tolu, I had already washed my hands and I've pulled the curtain. And in addition to that, I did your vital signs outside. It was within normal limits. I checked your height and your weight. Those are also within normal limit for your age.
Okay.
So before we go on, I want to let you know that the genitalia and the breast exam will be deferred in this physical assessment.
Awesome.
All right. And then also, while we're doing the assessment, if you're feeling any kind of pain or you're experiencing any kind of discomfort or you're feeling uncomfortable, please let me know.
Okay.
All right. So the first thing I'm going to do is I'm going to be looking at you. And right now, as I'm looking at you, I'm looking at your posture. I can see that you have really good posture. I can see that you also were very well groomed and very well nourished. You have no lesions on your skin. I can see that your turgor is great, no tinting, and there's no, your skin is not taut. Now, the next thing I'm going to do is I'm going to be looking at your scalp. All right. So I'm going to palpate your scalp. And as I'm palpating for any kind of deformities, any masses. I'm trying to see if there's any lesions, and I don't feel any. Your air distribution is great. And I also was looking to see if there was any kind of lesions. I'll be stopping to measure for color, contour, and shape. All right? Then I'm going to have you smile for me. And then I want you to frown. All right. So what I did there was I was looking at the motor component of cranial nerve number 7, and I can see that it's intact. All right. Next thing what I'm going to have you do is I'm going to have you open and close your mouth for me. Great. So what I just had to do was I was just assessing the TMJ, which is the temporal mandibular joint. And this joint, two things with that. I just checked if there was any popping, any crepitors, or any clicking. I didn't find any. And secondly, we're testing the motor component of the trigeminal nerve, which is the cranial nerve number 5. Now, let's test for the sensory component of this nerve, okay? So to do that, I'm going to use this Q-tip. I have a sharp end and I have a dull end. This is the sharp end and this is the dull end. So I'm going to have you close your eyes and tell me if it's sharp or dull.
Sharp. Dull. 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 Sharp.
Okay.
Sharp. Dull.
Great. So what I've just successfully done is to ascertain that her sensory component of the trigeminal nerve and every other part of her body is intact. The next thing that I'm going to do is I'm going to be checking for more sensation with the tuning fork on your bony prominences. So please close your eyes and tell me if you feel it.
I feel it. Yes, I feel it. I feel it. Yes, I feel it.
Great. Now, what I'm going to do is I'm going to do an exam on your eyes. First thing I'm going to do is I'm going to visually assess your eyes. I'm looking at the iris. I'm looking at the cornea. I can see that your sclera is white. I can see that your conjunctiva is pink. I can see that your pupils is normal. There's no dryness, and I don't see any discharge coming from your eyes. So the next thing I'm going to do is I'm going to do a vision test, okay, with a Snelling chart. So I'm going to have the Snelling chart 6 feet away from you, and I want you to cover one eye and then read the bottom line for me.
LTFPH.
Great. And then I want you to cover the other eye and read that same line backwards.
HPFTL.
Great. Good job. So you have 20/20 vision. Now I'm going to test your optic nerve. And to do that, I'm going to test with a pen light, and I'm going to test for accommodation. So I want you to follow the gaze of this. I want you to just focus your eyes on it, okay? And I'm going to move it closer to you. Good. So our accommodation is great. Optic nerve, cranial nerve number 2 is intact. Then I'm going to test your field of gaze for cranial nerves number 3, 4, and 6, okay? So to test for that, I'm going to use the pen light as well. And I want you to just follow with just your eyes only, okay? Great. So your cranial nerves 3, 4, and 6 are intact. Now, and when I was doing that, I did not notice any nystagmus or any this conjugation. In fact, your eyes were conjugated in their movements. All right. So the next thing I'm going to do is, again with the pen light, I'm going to test for pupillary reaction to light. So look straight ahead for me, and I'm going to check your pupillary reaction to my pen light. Good. So what I just noticed with that was a constriction from 4 millimeters to 2 millimeters of your pupils. They're equal, they're round, and like I said again, it was a brisk reaction to my pen light with accommodation, which is great. Then, right now I'm going to test for peripheral vision. So to do that, I'm going to stand right in front of you, and I want you to cover one eye, and then the other eye look straight ahead of me, and then I want you to tell me how many fingers I'm holding.
2.
2. Good. Let's cover the other eye, and then let's tell me how many fingers I'm holding.
1.
Great. So our peripheral vision is intact as well. And then the next thing I'm going to do is I'm going to be looking at your ears. Before I use the otoscope, let me just quickly assess the outer ear. I'm looking for any drainage. I'm looking for any bleeding. I'm looking for any lesions, and I don't see any swelling or tenderness. Was that tender when I was touching it?
No.
Great. So now I'm going to use the otoscope, and I'm going to be looking into your ear to check your eardrum and your ear canal. Okay?
Okay.
And what I'm looking for, I'm looking to see, oh, that's great. Your eardrum, the tympanic membrane, is actually pearly gray, and it's translucent. I did not see any bruising. I did not see any drainage, any swelling, or any bleeding.
Awesome.
There was no debris either. Okay? And then the next thing that I'm going to do is I'm going to be doing some tests, some hearing tests. Okay? The first one is called the whisper test. All right? So I'm going to cover one of your ears. I'm going to whisper something into the other ear and tell me what I've whispered to you. Okay?
4.
And then the other ear.
1.
Great. She passed the whisper test. The next test with a tuning fork is the Weber test. So with the Weber test, I'm going to place it on your forehead, have your eyes closed, and tell me if you can feel this vibration in your right ear, your left ear, or both ears.
Both ears.
Great. And then the next test is called the Rene test. The Rene test is going to compare air conduction to bone conduction with sound and with a vibration. I want you to tell me when you stop feeling the vibration on your mastoid.
Now.
Okay, and how about now?
Now.
Great reaction. So our air conduction was twice as long as bone conduction. Next thing we're going to do is I'm going to be looking at your nose. So with your nose, what I'm looking at first of all is I'm going to be just assessing it. And one thing I'm going to do is I'm going to have you block one of your nose, and then I want you to breathe in, and then block the other nose, and then breathe in. Great. So with that, we just ascertain that she has good patent nostrils. And then the next thing I'm going to do is I'm going to be looking into your nose with this otoscope. I want you to raise your head up a little bit. And what I'm looking at your nasal turbinates. I'm looking at your nasal septum. I'm looking to see, I can see that your mucosa is actually pink. I can see that it's moist, and I don't see any bleeding. I don't see any nasal polyps. I don't see any deviation of your nasal septum, and your nasal turbinates look good. Now I'm going to palpate for your sinuses. I want you to close your eyes for me. So I'm palpating the frontal sinus right now, and I'm also palpating the ethmoid sinus and the maxillary sinus. Does that feel any tender?
No, it felt good.
Great. I know, I wish I could continue. Now the next thing I'm going to do is I'm going to be testing your olfactory nerve, which is the cranial nerve number 1. All right, I want you to close your eyes, and then I want you to tell me what you smell.
Ooh, alcohol.
Alcohol, that's a strong smell, huh? I know. So her olfactory nerve, cranial nerve number 1 is very, very intact. Now the next thing that I'm going to do is I'm going to be going down to your mouth. Your mouth is what we're going to do next. So I'm going to have you say, ah.
Ah.
All right, great. So what I just did there was I just assessed your mouth. I saw an equal rise of your uvula and your palate, and that tells me that the hypoglossal and the vagal nerves are intact. And also, as I was doing that, I looked at your tonsils, and you actually do have tonsils. They're both symmetrical, and I saw that, you know, there was no asymmetry. Asymmetry would have meant that maybe there was swelling, and that swelling could have meant that maybe you had peritonsillar abscess, but you don't have that. Now, what I'm going to have you do now is I'm going to have you just smile for me. All right, great. I can see your teeth. You have some pearly white teeth, and I can see that they're complete. There's no caries, and I also notice that nothing is missing. Great, great teeth, great dentition.
Thank you.
Right. Now, the next thing I'm going to do is I could have checked your gag reflex, but I'm not going to. But if I were to check it, I'm sure you have positive gag reflex, and that tells me that your glossopharyngeal and your vagal nerves are intact.
Okay.
All right. And then the next thing that I'm going to do now is I'm going to have you stick out your tongue out of your mouth. Great. Move it up, move it down, side to side. Great. And then close your mouth, and then I want you to push your tongue against your cheeks. Great. So hypoglossal nerve is intact. Now, let's assess your neck. We're moving down now a little bit, slowly but surely. So one I'm looking at right now is your neck. So the first thing I'm going to do is have you turn your neck to one side. And then as you turn it around, I want to have you swallow for me. Great. So as you swallow, what I did there was I was looking at your thyroid. And it's normal, it's fabulous. I didn't feel any nodules and I didn't feel any swelling. There was no tenderness. Was that tender for you?
No.
Great. And then I'm going to palpate your lymph nodes.
Okay.
So what I'm doing right here is I'm palpating for mobility, I'm palpating for size, I'm palpating for swelling or tenderness, and I don't feel anything. Was that tender for you?
No.
Great. So we just successfully checked your neck, and now before I leave that part of your body, I'm going to just also palpate for thrills, carotid thrill. Great. And what I noticed was that I didn't feel any thrill. Now the next thing I'm going to do is I'm going to have my hand on your shoulders, and I'm going to have you shrug for me. Great. So your spinal accessory nerve is intact.
Okay.
That's your cranial nerve number 11. Then the next thing we're going to do is we're going to do some ranges of motion, okay? So I'm going to have you turn your head to one side and then turn to the other side. And then I want you to flex your neck down and then extend it up. Great. So we're going to do strength test now, okay? I want you to turn your head against my hand. Turn your head against my hand. Great. So that was intact. Great. Wonderful. Next thing I'm going to have you do is I'm going to have you stand up. And then I'm going to have you flex your shoulders up and then extend your shoulders down. Now I want you to abduct your shoulders and then adduct them. Great. Then I want to have you do a biceps curl. Great. And then extend. So that's flexion and extension of the elbows. Now let's do a strength test with that. I want you to resist. Great. And then resist. Great. Good strength. That's about 5+ for me. And then one thing we're going to do now, let's go on down to the wrist. So I want you to flex the wrist, extend it, flex it. Great. And then side to side. And then let's do the same thing for the fingers. Let's abduct, adduct, abduct. And then keep them open. I want you to keep them abducted. Don't let me close them. Great, great, great. That was wonderful. And now the next thing I'm going to have you do is I want you to flex your hip, extend it. Then let's abduct it. Adduct. Great. That's wonderful. Now what I'm going to have you do is sit down for me. Then let's flex your knees, extend them. Great. And now let's do strength test with that. Great. Let me pull. Great. Now let's do a dorsiflexion and plantar flexion. So you saw that with the toes. So that was wonderful. Now the next thing we're going to do is I'm going to be checking your reflexes. As you saw, we only did one side. You want to do the other side. Make sure that it's symmetrical with the movements and also it's symmetrical with the strength test. So with the reflexes, the first reflex I'm going to be doing is called the brachioradialis reflex. Great. That was great movement. And now let's do your biceps reflex. Great. And now let's do your tricep reflex. Great. And then let's do your patellar reflex. Great. And then your Achilles reflex. Great. And then your Babinski reflex. Right. With the Babinski reflex, I noticed that she crawled up her toes instead of fanning them out, which is normal. If she were to fan that, that would be indicating of a neurological deficit. Now, let's do some cerebellar function. So I'm going to have you stand up with your eyes closed, and I want you to have your hand out, and I want you to use your fingers to touch your nose with your eyes closed. Great. Next thing I'm going to have you do is put your hands, palms down on your thighs. I want you to do rapid alternating movements. Great coordination. And then next thing I'm going to have you do is have your, that's okay now, have your heel on your shin. Your shin. Do the same thing on the other side. Open your eyes, and I want you to touch my finger to your nose. Same side, other side, yeah. Great. Then I want you to walk towards the camera. Walk back on your toes, and then on your heels, and then walk heel to toe. And then when you get here, I want you to do, that was great, shallow knee bend for me with your hands in front of you. Great. Now let's do a Rombuck test. I want you to put your feet together, your hands in front of you, and I'm going to just have you close your eyes.
Okay.
I'm checking to see if you sway. There's no swaying, and there's no imbalance. And a joint position sense is great. You can open your eyes now.
Okay.
That was wonderful.
Thank you.
So now we're going to go to your chest and back. So I'm actually going to have you turn your back towards me. As you were walking, I noticed your spine looked really great. Symmetry is amazing. And so let's do one more range of motion. I'm going to have you take a bow for me, and that is spine flexion. And as she rolls back up, that's spine extension. So that's wonderful. So while you're here, I'm going to do something called tactile fremeters. And so when you feel my fingers, I want you to say 99.
99, 99, 99, 99.
And turn back around. Do the same thing.
99, 99, 99, 99.
So what I noticed was as I was doing that, I felt that bilaterally I could feel the vibrations, and they were equal from side to side. Asymmetry would have meant that there's pleural effusion, there's some consolidation, maybe masses of fluid in the lungs. That was wonderful. And now what I'm going to have you do is turn back around. I'm going to check your breathing. So I'm going to do a respiratory excursion here. Take a deep breath for me, in and out. Great. One more time. Great. So my thumbs move outward symmetrically, so which means that her chest rise and chest fall were equal. Now let's do a diaphragmatic excursion. So let's take a deep breath and hold. Take a deep breath from me and hold. Good. Good. You can release. Right. And then exhale and hold. You can go ahead and breathe normally. So here it's about 4 centimeters. What I've done here is I've successfully measured the change in the level of our lungs with breathing in and breathing out. It's normally 3 to 6 centimeters. Hers is 4 centimeters within normal limits. Amazing. So next thing I'm going to do is I'm going to auscultate. Okay? So auscultating, I'm going to be listening to our lung sounds, checking for rate and rhythm. You can breathe normally with my diaphragm. So right on top, it's the bronchial sounds. A little further down, bronchiovesicular, and a little further down is the vesicular sounds. And turn back around, I'm going to do the same thing on the anterior chest. And I saw that your breathing is normal. And now as I'm looking at you, I'm looking at your chest. I'm looking, as I was doing that, I was checking for any adventitious sounds, for any rails, any crackles, or any wheezes, and I didn't see anything. And I'm looking at your chest, the shape of the chest for concavity. I'm looking for any barrel chest, any pigeon chest, none of that. And the anterior to posterior diameter is about 1 to 2, which is normal. You can go ahead and sit down now. The next thing we're going to do is we're going to be auscultating cardiac function. We're going to be doing cardiac function. So first thing I'll be doing with that is I'll be looking at your pulses. All right? So your radial pulses and your pedal pulses. And as I was doing that, I could feel that they were nice 2+ rate and rhythm. And I also felt the strength 2+. So no bounding, no thready pulses, and it wasn't weak.
Good.
All right. So next thing I'm going to do is I'm going to be looking at your. I'm going to be auscultating. So to auscultate, S1 and S2 is better to use your diaphragm. S3 and S4 is better to use your bell. But I'm going to be auscultating for some landmarks. So the first landmark is the one that is second intercostal space. So it's second intercostal space, and it's to the right sternal border, and that's where you would hear the aortic valve. Then parallel to that on the other side, opposite to that is the second intercostal space to the left sternal border, and that's the pulmonic valve. A little further down is the third intercostal space to the left sternal border, and that is the Herb's point. And then fourth intercostal space a little further down to the left sternal border is the tricuspid valve. And then a little below that, further down, is the fifth intercostal space. And you want to go a little lateral to that, and that's the fifth intercostal space mid-clavicular line. And that's where you would hear the mitral valve. That's also where you would measure your apical pulse. And right there, that landmark is also called the point of maximal impulse. So those are all the landmarks you would measure with the stethoscope and with the bell, with the diaphragm and the bell of the stethoscope. Do you have any questions so far?
No question.
Now let's go right ahead into the abdomen before I let you go.
Okay.
So I'm gonna have you expose just your abdomen. So with the abdomen, what I'm doing first is I'm inspecting. And I'm inspecting to see if there's any masses. I'm inspecting to see any scars, any lesions. And I don't see anything. It actually all looks good. The next, what I'm going to do is I'm going to auscultate. I'm going to auscultate for two things. The first thing I'm going to auscultate with my diaphragm, I'm going to auscultate for the lung sounds. So all four quadrants, I'm auscultating. And I actually could hear they're all normal bowel sounds, normal active. It's not hyper, it's not hyperactive. Then with my bell, I'm going to auscultate for brewing. So I'm going from the abdominal aorta to the renal arteries bilateral, to the iliac arteries bilateral, and to the femoral arteries bilateral. And I don't hear any turbulent flow. It's actually pretty good. The arteries are very well, and they're good. They're patent. Then the next thing I'm going to do before I finish is I'm going to palpate lightly. And I'm palpating for masses. I'm palpating for anything that's abnormal. Any discomfort?
No.
Any tenderness?
No.
Great. So, and that marks the end of it. Our assessment for today. Thank you very much.
Sure.
Your physical, you passed it. And it was nice doing this with you. Thank you.